Buddy, Dr. Kwon here, and again, I'm a medical oncologist who specializes in prostate cancer, and this is part 3 of a video series on making well-informed decisions in advanced prostate cancer. I'm here with Fred, who you all know by now, and Fred, can you tell us what we're going to discuss today?
Yeah, today we're going to discuss the options we have during treatments and how do you decide which option to pursue. I think that's it.
Yeah, pretty much. You got to realize and learn from your oncologist what the menu of options are in order to really be able to choose. So for your particular situation, and actually if there have been updates in your situations, let us know. What were the options?
Well, at the stage that we're talking about the option of hormone therapy, my option was really only to start immediately as my PSA had gone up a little bit, or to start later. We kind of adopted a kind of, active surveillance, if you will, for about a year and a half. And then my PSA level started rising pretty dramatically, and in fact doubled. So that's when I decided we should start it now as opposed to later. I had quite a bit of time. I had about a year and a half before I really had to make this call on the hormone thing. I knew it was coming. I just didn't know when. And, luckily I was able to put it off. And the only reason I really wanted to put it off is because of my fear of the side effects of the medicine, which we can talk about later. But that has dissipated, quite a bit. So that's why I decided to go ahead at this time. Anyway, my first option was to do nothing. Just wait, watch your PSA number, see how it goes, and reevaluate it from time to time. And then about a year and a half later, a year and a half ago, my PSA really started rising, and that's when it doubled. So then this discussion about hormone therapy came up again. And I decided option 2 was to wait, but I have waited. I waited that time, and now it's time to start. So that's why I didn't really have to pull the trigger on it until, in my own mind at least, and the doctors, of course, my PSA was at a level that it was starting to be a bit alarming.
Yeah, I think that's a fantastic summary of what's been happening for you, and sounds like the options were start now with the PSA the way it is, or wait, see the PSA go higher, and then at some point in the future to start treatment at that time.
Right.
And what sort of treatment were we talking about? So just we're all on the same page here.
Well, it was an injection of Lupron and abiraterone. Abiraterone, of course, is in the form of pills. So I had the hormone injection about 3 weeks ago. And again, I was referring earlier to the side effects of this drug, and that's the thing that really put me off of pursuing it. But luckily, through the work of my support group, talking to all those fellows, I realized that there are side effects. Most of us will get some of them, but not necessarily all of them. And at that point, I kind of, it became a much more philosophical discussion for me. Now it was just a matter of, do I start now? The sooner I start it, the sooner I can get off it, at least for a while. So I finally just took the plunge. I was very concerned about the side effects. I still am. It hasn't kicked in yet. So we'll see how it goes in the future. But for now, so far, it's fine. I feel the same. So that was a big hurdle to get over. Just getting rid of that fear of the side effects.
Yeah, thanks, Fred. There's so many things that we could spend hours just talking about what you just said, but maybe for the sake of, just sort of the purpose of this particular video is knowing what the options are, and then getting a list, and then what is each option. And, the 2 options, early waiting versus doing it now. Can you just tell me actually, what was the PSA when you first started being recommended by your doctors to start this hormone treatment? And then what has your most recent PSA been when you actually started?
Well, one of the things that's always concerned me about this is very early on, they wanted to start me on hormone therapy. And when my PSA was much lower, 0.01 or so. But I think they've realized that was the only option left to me in terms of treatment. But since in that time, I mean, it went from 1.2, which was concerning, but not over alarming, but then it doubled to 2.4. And then that was with a couple of months. And then 2 months later, it went to 3.3. And now it's 4. So, it's not going away, it's getting bigger. So,
Yeah, and I also want to tell everybody that there is no magic number at which hormone treatment should be started. There have been big picture studies where generally a lower PSA starting less than 5 is better than waiting until something where it's way higher, like greater than 10.
Right.
But within the less than 5 period, is it better to start at 1 or 4? Nobody really knows.
Right.
There are a lot of factors like patient preferences about the side effects, also how quickly the PSA is doubling. You mentioned that yours doubled after 2 or 3 months.
Yeah.
So that's a short doubling time. So these are all factors that and you need to talk with your friend's family and doctor to figure out what makes the most sense for you.
Sure.
And before we end, I did want to clarify what these 2 treatments you were talking about are for our viewers. So you mentioned Lupron. There are other names of this injectable, including Firmagon, Eligard, Zoladex. There's also now an oral form called Relugolix. And these are all types of treatments to...
Mine is Eligard.
Eligard, there you go. To decrease your testosterone level, because the prostate cancer basically uses testosterone in the body as its food. And you're starving it to death by shutting down production of testosterone. Abiraterone, another, the brand name for that is Itiga, given with prednisone, is an additional hormone pill, like you said, that in studies has been shown to further control prostate cancer than just doing the first set of treatments I mentioned alone.
Right.
And so this is a very standard recommended treatment regimen for people in your situation.
Right.
Great. So we'll get into the details of each option in the subsequent videos. And before I end, actually, I do have this one follow-up question, final question. Is there anything else you wish you would have known from these 2 options over the past year or 2 when you're making this decision?
No, not really. I've alluded to it before, but I wish I had known about all these treatments that were coming down the pike. I had a radical prostatectomy, and I figured, well, I'm home free now, it's gone, right? And then I found out that's not how prostate cancer works. So I think if I had known way back then that, we're going to do this, if this doesn't work, we're going to do this. This doesn't work, we're going to do this. I don't know it would have changed any decision I made, but it would have been, I think, helpful, to know what was coming down the road, if things didn't go the way we wanted to, so. But no, my preference again was to avoid the side effects as long as I could, and then I made the opposite decision, which is, well, I want to live, so let's get on with it. So that's really where I'm at, and I embraced it wholeheartedly at that point. So.
Great. Yeah. Thanks for sharing, Fred.
Sure.